This chapter is over visual deficits following brain injury. So the function of the brain is to filter, organize, and integrate sensory information to make an adaptive response to context surrounding the person. The brain receives sensory information, including visual, proprioceptive, tactile, and vestibular, and auditory. Vision is used with information from other systems to adapt situational context, so to act on it, manipulate, mold, and improve it. Vision acts as a warning system and anticipates developing situations and forms a plan. So here's a visual of the processing within the CNS. So the visual system is our most important sense in regard to learning, memory, recall, including our ability to see color and fine details, as well as visual surrounding and global relationships. It's also for communication, spatial temporal orientation, and early warning system to pleasure or danger, and then also the visual manual and visual motor activities. So here's the hierarchy of the visual perceptual processing. The ability to use vision to adapt to the environment, which requires the integration of vision within the CNS. So the visual perceptual hierarchy consists of the processing of the visual cognition, visual memory, pattern recognition, visual scanning, and visual attention. So it's broken down into a pyramid shape. And within the hierarchy, each process is supported by one another that precedes it, and it cannot properly function without integration of the lower level process. The ability to adapt through vision is the result of process working in synergy. So within intervention, if a client has visual impairments following brain injury, the OT works with two medical disciplines. So optometrists are trained in providing vision care and management of vision. They can also prescribe appropriate medications, and they also can diagnose. This is somebody that you would probably see for your yearly checkup. Okay, and then there's ophthalmologists, and they're more responsible for surgical procedures of visual correction, such as cataract removal. So, assessing visual performance. The book talked about the brain injury visual assessment battery of adults. So this assessment is designed to assist OTs in developing effective intervention plans for adults with visual impairments caused by brain injury. OT intervention approaches are remediation and compensatory. So remediation attempts to establish or restore clients' ability to complete visual processing by improving aspects of the visual performance. And then compensatory is really all about changing the context of the environment or task to enable the client to successfully use their current level of visual processing. So visual acuity is the ability to see very small visual details. Deficits within this area are due to disruption of the ability to focus light on the retina, inability of the retina to accurately process the image, and also the inability of the optic nerve to transmit the information to the rest of the CNS. So whenever you have central acuity issues, there's an inability to discriminate small visual details. So you'll see problems with reading recipes, paying a bill, shopping, writing a check, or even applying makeup. And the test can be done using the Snell chart. Visual field is really just talking about how the person sees the external world whenever you're looking straight ahead. So the normal visual field extends from 60 degrees superiorly, 75 degrees inferiorly, 60 degrees nasal, and 100 degrees temporal. Deficits are seen, trouble seeing things on their blind side, narrow scope of vision, So they'll have trouble reading or driving, and sometimes have trouble with their mobility. Assessments is to use perimetry. And then intervention, so whenever they have difficulty with mobility, it's just because more or less that they're not turning their head far enough or fast enough over to the side. So they're not able to take in the necessary information to continue moving safely. And then also difficulty reading, and this is more or less due to the lack of smooth saccadic movements of the eye. So oculomotor, the visual attention and scanning. Visual attention is the ability to observe objects closely and carefully to discern information about their features of the relationship to oneself and the object or in the environment around them. So there's two categories: focal and ambient. So focal is used to the recognition of identification of objects, and then ambient is concerned with the detection of events within the environment. So deficits really stem from hemi-inattention. So the client misses visual information on the left side. And occupational limitations are seen through driving or problems with reading. And their intervention should incorporate compensatory strategies, so changes to their environment. Oculomotor functions. So the purpose is to ensure that the object that the person wishes to view is focused on the fova of both retinas, and that they're able to focus for a certain amount of time that's needed. So deficits, there's two different types. So specific cranial nerve lesions causing paresis or paralysis, and the disruption of the central neural control of the extraocular muscles affecting the coordination of the eye movement. So it's really predominantly seen in paralytic strabismus and diplopia or double vision. Occupational limitations include perceptual disorientation or distortion, which may affect eye-hand coordination, postural control, and binocular use of the eyes. So, okay, and then the assessments within this is you really want to obtain their visual history and ask them if they've experienced any type of diplopia. And then you're going to want to observe the symmetry of the eye movements, whether their eyes move from the same distance in each direction, whether their eyes are able to stay on target for a minimum of jerking movements, and whether the client is able to hold the eyes in a deviated position at the end of the range for 2 to 3 seconds. So interventions are divided into 4 types: occlusion, application of a prism, eye exercises, and surgery. And here are 2 different examples of prisms applied to the eyewear.